up to 30% of people with depression don't respond to regular existing forms of treatment. And this isn't just depression, there are cases of other conditions as well, such as functional neurological disorders. So in those cases, it would be important to consider alternatives like neurotechnology approaches. Neurotechnology refers to tools and approaches that allow one to measure activity of the brain, but then also modulate it. One of the myths is that these approaches are only for rare or very extreme conditions, but that's not the case at all. There's a large body of research and already clinical practice around the use of neurotechnology to treat conditions like depression, but also functional neurological disorders, which are another very common condition. Another myth is that neurotechnology approaches are mainly the stuff of research rather than clinical practice, but they're already widely in use for treatment for depression and anxiety and other conditions, so they're very much something that has large clinical translation capability. In the context of FND, there is a real lack of available treatments in this population. It's my hope that brain-computer interfaces, rather than kind of replacing already existing fantastic physiotherapy and occupational therapy rehabilitation approaches for the condition, can serve to supplement it. And that's why for my PhD I'm looking to set up the first trial of brain-computer interfaces and virtual environments for FND for our trial, the BRAVE FND trial. The approach I'm using is a motor imagery rehearsal-based BCI, where individuals have an EEG headset. They think of moving, and this is an oversimplification, but they think of moving their hand or their foot. As they carry out that motor imagery and think about it, an avatar on screen moves their hand or foot, and at the same time they have stimulation via an electrode that triggers real-world movement of the hand or foot. This is an approach that has been used to study rehabilitation in stroke and spinal cord injury, but to date no one has looked at it in FND. Part of my research looking at brain-computer interfaces for functional neurological disorders seeks to kind of bridge that gap, that false dichotomy between physical and mental health. And I think that's why it's so important to have a collaborative approach, like the approach provided by King's Health Partners, where you have clinicians from different specialties, neurology, psychiatry, working together with researchers in neuroscience, life engineering, and other wider fields, including innovation and technology. And I think it's only by taking this collaborative approach, really, with, most importantly, having the patient at the centre, that we can provide a holistic approach for these conditions.